I was diagnosed in January 2017 with multiple myeloma, which is a plasma cancer, or cancer of the plasma cells. And originally I was admitted to ER at St. Paul's with acute renal failure. So that's how I was ultimately diagnosed, was that incident. And that led to chemotherapy starting in January 2017. And ultimately right through to today. I had a stem cell transplant in December of 2018 and then resumed chemotherapy in September, a little earlier, of 2019. So multiple myeloma is in the category of blood cancers like lymphoma and leukemia. It's an incurable cancer, but it's treatable. So my chemo today, my regime is ultimately 6 treatments every month. So I'm at St. Paul's 2 times a week for the first 3 weeks of every month. And I also receive now immunoglobulin, which is helping me boost my immunity against a bacterial infection. And also a bone builder, which helps replace the calcium that I lose as a result of the cancer in my bones. So it keeps them less brittle. This has been a really fluid situation with COVID-19, as everybody knows. I was at St. Paul's on Tuesday for my treatment, and St. Paul's is being a downtown hospital with many downtown residents surrounding frequently and often in the hospital, and many of those residents are high risk, I would say. So it's an interesting situation that the hospital is in. So outpatients need to navigate their way through the hospital to get to their treatment areas. And now with COVID-19, there's a heightened degree of awareness and concern about running into people that you just don't know whether they have symptoms or not. So on Tuesday I arrived and went up the elevator, and what appeared to be a homeless person, and again, nothing against them, but got onto the elevator, and there was 2 others in the elevator with me, and we all turned around and tried to avoid him. And it immediately struck me that the hospital needed to do a better job of not just keeping them out, but anybody who might have symptoms or could be putting people with immunocompromised situations at risk. So that was what I'd found, that there really wasn't any apparent control. And my experience over the past 2 years has been very much that, but it wasn't really a concern because I was relatively healthy and we didn't have a pandemic. I had another treatment on Wednesday, and it was night and day. I arrived in the parkade, and the doorway to the hospital from the parkade had a nurse and a security guard interviewing everybody before they entered, asking them if they had any symptoms, why they were there. Had some hand sanitizer that made people wash their hands, and then if you were okay, you could go in. So that was a huge relief. So that was a tremendous change. And I did have a call later yesterday from Janet Silver, who is the patient care representative for Providence, and she explained what they had put in place, and it was really just over the last 24 hours, was these controls at every entrance and closing some entrances altogether. So that's been a huge improvement. There hasn't been great communication about what they've done, and that's the other frustration, is getting the word out to outpatients that it's safe to go. They're not allowed to communicate, I guess, directly with outpatients via email, and there hasn't been anything posted that I could find on any websites to explain the new protocols for access. So I think that's also important for outpatients and their families to know what the hospital is doing. The care at St. Paul's that I've been getting from the doctors and nurses and support staff has been phenomenal. So, the hospital is doing a great job. All the nurses are clearly overwhelmed and concerned, but still coming to work every day, and they're doing a great job. It's really, I think, all about communication, and I think just given how fluid things are, it's tough to be really on communication when you need to, but it's going to be important.